Hello, my name is Nicole Duncan, and this is my C350 assessment. And we're going to welcome the patient when I come into the room. I'm going to wash my hands and introduce myself. And can you tell me your name?
John Duncan.
Can you tell me where you're at and what time it is?
We're in the doctor's office at 1 o'clock.
Okay. Well, welcome. So I'm going to tell you a little bit. We're going to do a comprehensive health assessment, and that's going to include a head-to-toe physical. Okay, is that okay with you?
Mm-hmm.
Give your permission?
Yes.
All right, let's get started. So can you tell me why you're here today?
For a new patient exam.
Okay, all right. Do you have any other concerns you'd like to share with us while you're here today?
I do have a history of AFib and aflutter.
Oh, okay. So good. Is that the only medical history you have?
Yes.
Okay. Are you taking any medications?
Yes, Ticacin.
And how often do you take that?
Twice a day.
Twice a day? Okay. Do you know the milligram by chance?
500.
Okay. Thank you very much. Do you have any allergies?
No. Well,
Okay.
yes. I have two baby aspirin.
Baby aspirin.
Yes.
Okay. And what does that do?
Breaks me out on a skin rash.
Okay. And how are your vaccinations? Are they up to date?
Yes.
Have you had your flu shot this year?
Yes.
Okay. Have you had your pneumonia vaccine by chance?
Yes.
Okay. In the last 5 years?
Yes.
All right. Tell me a little bit about your family history. Anything I should know?
My mother had a heart attack, and that's it.
Okay. All right. What about your social history? Tell me what you like to do for fun.
I like to do martial arts, hang out with my family, and watch movies.
Okay. Are you married?
Yes.
All right. Children?
Yes.
How many?
4.
Okay. Do you smoke?
No.
What about drink?
On occasion.
All right. And do you exercise?
Sporadically.
Sporadically? Okay. We're just going to talk about real quick before we get to the head to toe. We're going to go over a review of systems. Is there anything, are you having any chest pain?
Yes.
Okay. Is that, now tell me about that. Is that going on right now?
No, not right now.
Okay, so you have a history.
I do have a history of it.
Okay. Can you describe it and tell me how often, what makes it worse, what makes it better?
So far, it seems to happen at night.
Okay.
And
When you're laying down?
Yes.
Do you wake up with chest pain?
No.
Okay.
No. Once I go to sleep, I don't wake up, and then when I wake up in the morning, I'm fine.
Okay. So it's when you first lay down and you're awake?
Yes.
Okay. All right. Can you describe that feeling? What type of pain is it?
Sort of like exercising.
So maybe some shortness of breath?
Yes.
Feels like your chest tight?
Yes.
Okay. Are you having any cough?
No.
Any generalized weakness?
Yes. At night.
Okay. Just so at the end of your day.
Yes.
Is there anything that makes it better?
No.
Okay. And what about shortness of breath? Are you having that?
Nope.
Okay.
Not right now.
All right. Okay. Well, we'll look a little bit more in depth in your head to toe physical and see what we can see. And if there's anything else that you think of during the assessment that you want to let me know or that sticks out, please feel free to let me know. Okay. So we are going to start with your vital signs, but can you tell me your height and weight?
6'3", 234 pounds.
All right, 6'3", 234 pounds. And so I'm going to start real quick with your vital signs. And we're going to place the blood pressure cuff here. right.
Is that like a real one?
Okay. Blood pressure 130/75. So that's good. Not high. What does your blood pressure normally run?
It normally runs low.
Normal? Okay. All right. I'm going to check your pulse for 30 seconds. And your respirations. All right. Pulse is 95. Respiration 16. And Mr. Duncan, I do want to just make sure that you understand that we keep your healthcare information private here. So if you have any questions or anything during the assessment, make sure you let me know. Is there anything else you'd like to say before we get started?
No, ma'am.
All righty. And your radial pulse, it was regular. I didn't feel any abnormal beats. I know you mentioned the AFib and the A flutter, but it was the rhythm was not bounding, and it was regular through your radial pulse when I was checking your pulse. And so we're just gonna start right now. I'm just kind of assessing your skin. I'm just looking. Your color looks good. Your color pigmentation is uniform. Do you have any skin issues?
Not that I know of.
Okay, and your skin was warm. It was warm on both sides. Just kind of looking for oxygenation and things like that. Your skin is dry, texture is smooth. So right here, I'm just going to do a little pinch to the front of your hands, and I'm checking your skin turgor. This just helps to see if maybe you might be dehydrated in any kind of way, but your skin turgor was very elastic. There was no issues there. I don't see any lesions, and I want to check your nails real quick if you don't mind. Hands, no lesions. I don't see any scratches. And your capillary refill is within 3 seconds. And next we're going to move on to your head and face. Okay, so I will be kind of placing my hands on your head. If you could kind of just turn a little this way, just a little bit, so I don't want to block the camera. Thank you. All right, so I'm just going to kind of feel. I'm checking your head for any lumps, lesions, masses, nodules. Hair distribution looks good. I don't see any lesions or dry scalp or anything like that. The head is round and symmetrical and normocephalic. Can you smile for me real quick? We're going to check your cranial nerves. Oh.
Okay.
Okay. Now frown. There you go. Raise your eyebrows. Okay. Good. Thank you. Just feeling for your temporal artery. It's elastic. Your pulses are not bounding. They're good. All right. Now I'm going to move down to your jaw. Can you open your mouth and close it, please? We're going to check your temporomandibular joint. I don't feel any clicking or popping or anything like that. That's good. I don't see any redness or tenderness around that joint. And then I'm just going to feel your frontal sinuses. Do you have any pain?
No.
Woo! Am I making you nervous? You're sweating now all of a sudden.
No.
Feeling your maxillary sinuses. Any pain?
No.
Any sinus issues?
Right now?
Okay.
No.
No, not right now. Okay. All right, well that looks good. Your head and face, I don't see any issues. All right, I'm gonna go ahead and check your ears since we're here. I'm checking both sides. They're symmetrical. The auricles are symmetrical. I'm folding the pinna on both sides and they rebound well. They don't stay folded. I do want to, are you having any tenderness when I touch around your ears or anything like that?
No.
Okay, they look good. I don't see any drainage. I don't see anything coming out of your ears. Real quick, I do want to do a hearing test. I'm going to whisper, cover this ear. I'm going to whisper something in here and you let me know if you know what it says. Could you hear me?
Yes.
Can you repeat what I said?
Violets are blue.
Right. Cover this ear, please. Can you repeat what I said?
Roses are red.
Okay, perfect. All right. Do you normally have any trouble with your hearing?
Yes.
Okay. Tell me a little bit about that.
My wife says it's bad.
Okay. All right. Okay. All right. Well, we're going to move on to your nose real quick. Just looking at symmetry. Do you have any pain when I touch your nose?
No.
All right. I am going to have you tilt your head back a little bit and I'm going to look into your nose. All right. Don't see any issues there. I don't see any drainage. There's nothing coming out. I need you to plug one side and breathe in for me like this. All right. Do the other side. We're just checking patency to make sure there's not any airway obstruction in that nostril. Okay. Everything looks good. No tenderness. Okay, we're going to go ahead and move on to your eyes real quick. So we're going to do a few things here. All right, we're going to check some visual field, your corneal light reflexes, cardinal position of gaze. We're going to look at the external structures and things like that. So we might be here for a few moments and it is going to be a little bright. First, I'm going to check the dilation of your pupils and make sure everything's equal. So real quick. All right, pupils are equal, round, reactive to light accommodation. So that's very good, Mr. Duncan. I'm gonna take a peek at your conjunctiva. All right, that looks good. It's moist, pink, no issues there. It's also your transparent. All right, let's move to some of your visual field. The sclera looks white. I don't see any yellowing or any abnormalities. All right, first I want you to watch right here, and then I just want you to follow it in. Okay, then we're gonna do the 6 cardinal positions of gaze. Just want you to follow with your eyes, not your head. Okay, good. I don't see any abnormalities there. All right, I do want to kind of look at your corneal light reflex. This is a light from 2 feet away. And I'm just gonna I'm looking, okay. I'm trying to make sure that the lights, when we shine that light into your eyes, there is a tiny little white dot that shows up and I just have to see where it is in your eyes and make sure it's in alignment, and it looked good. And I don't see anything structural wise. Everything looks good. Your eyes moved in unison. Okay. Now we're going to move on to your mouth and throat. Overall, your lips are pink and moist. I don't see any issues there. I am going to look at your teeth and gums. Say ah. Ah. All right, your uvula is midline. Your reflex, your soft and hard palate are intact. They look normal. Let's see, your tonsils. Let me see if I can see your... I don't see tonsils with your... All right, we're gonna just check your gag reflex. And I'm just going to simulate this. I would use a tongue depressor to check the gag reflex. All right, one more test that I do. Your tongue is midline and pink. I don't see any tooth decay. Your gums are pinkish. So what I'm going to do is I'm going to place my hand on the right side of your cheek, and I want you to move your tongue on the inside of your mouth to your cheek. There you go. Good job. Do the same on the other side. Good job. That's just checking another cranial nerve. All right, let me jot some things down for a second. That's all right?
Yes.
All right, next we're gonna move on to your neck. First, I'm always gonna do my visual inspection first. I'm just looking for any abnormalities. I'm looking for symmetry. I don't see any lumps, bumps, bruises, scratches, or anything like that. Before we move on to palpating and everything, can I just have you turn your head left to right, up and down? Okay. Any stiffness?
No.
Okay, good. All right, now I'm going to go ahead and do my physical exam of your lymph nodes. I'm going to feel around your neck, checking for any lumps, nodules. I don't feel any swollen lymph nodes. Your trachea is in midline. Can I have you swallow real quick? Okay, lift up just a little. I don't feel the thyroid. It's not swollen or abnormal. Okay, good. Last thing, I'm just going to take a listen. I'm just checking for any carotid artery bruits, which would be an abnormality. I'm feeling the carotids. Not bounding, regular rhythm. Okay. Any tenderness or pain in the neck area?
No.
Okay, good job. All right. Next, let's see what we're gonna move on to. All right, next we're gonna do your posterior and lateral chest and lungs. So I'm gonna move behind you. If you could scoot just a little bit further up, there you go, perfect. Wanna make sure we are in the camera's view. First of all, I'm just kind of checking. I'm looking, I'm feeling. I don't feel any nodules, bumps, bruises, anything like that. The skin is intact. I am gonna look for symmetry, for your breathing, just an inspection, and don't see any of that. No lumps, tenderness. I'm checking your spine. Can you bend forward just a little? There you go. Just kind of checking over your spine, making sure nothing feels out of line. Any tenderness when I press?
No.
Okay, good job. All right. Next, I'm going to have you say 99 and check for tactile firmitus.
Say 99.
Yes.
99.
Again?
99.
Again?
99.
And again.
99.
Thank you. All right. I'm going to do a quick percuss for CVA tenderness over your kidneys. Do you feel any tenderness when I do that?
No.
Okay, good job. All right. I'm going to listen to your breath sounds. All right. I'm going to listen for 2 breaths each. Okay, everything sounds normal. I don't hear any wheezing, no rhonchi or crackles, so that's good. now we're gonna move to, before I have you lay down, can you just face me? I'm just gonna check the front of your chest. I'm just looking for any abnormalities. Skin is intact, no lesions. We're gonna do the same thing in the front as well. You have symmetrical respirations. I don't see anything. I'm not hearing any audible wheezing, anything like that. All right, so I've done my inspection. I am gonna have you lay down now. All right, make sure that I think they will be able to see. All right, so we're kind of gonna do the same thing. I'm going to kind of just percuss over the lung fields. Can you hear that?
Yes.
Okay. Any tenderness, anything like that?
No.
Okay. Now say 99.
99. 99.
And again?
99.
Okay, good job. I don't see anything there. Everything's normal. Gonna take another listen in the front. Your lungs actually do come a little bit above your clavicle right here, so that's why we kind of listen up high. Are you doing okay?
Yes.
Okay. Let's make sure. While I'm here, I'm going to go ahead and listen to your heart. Kind of doing a visual inspection, and I don't see anything abnormal. So I'm going to listen to your apical pulse. Going to listen to the 4 chambers of the heart. Also going to feel for any heaves, which would be an abnormality, and any thrills, there's none noted. Your rate was 95. Heart sounds are regular. I didn't hear any AFib or A-flutter. I didn't hear any extra beats or anything, so that was good. All right. Okay. While I have you laid down real quick, I'm just looking for any jugular venous distension. Can you turn your head to the left? I don't see any abnormalities or pulsations that are beating that I can see visibly. Everything looks normal. Thank you. Nothing found. I'm gonna move on. We gotta remember to do your upper extremities, your range of motion. Can you wiggle your fingers? Move your arms up and down. Do you have any pain, tenderness, any issues with your range of motion or muscle strength in your upper extremities?
No.
All right, well, real quick, let me have you squeeze my hands. Okay, grips are equal and bilaterally. And, all right, real quick, can you press down on my hands? All right, press up on my hands. Okay, thank you. All right. I'm gonna feel for any epitrochlear nodes in your arms. I don't feel anything there. Everything looks, upon inspection, there is one scar right here, but other than that, everything looks good on the upper extremities. And let's see, we're gonna move on to our abdominal assessment. Just my visual inspection. I don't see, there's no distension, abdomen is round. I'm gonna lift this, if this is okay?
Yes.
All right. I am noting a pretty significant scar. Can you tell me what the scar is from?
Splenectomy.
A splenectomy, okay. And what did you have a splenectomy for?
I was in a car accident.
Car accident. And it ruptured. Okay. So that is a significant scarring here. I'm just doing my visual inspection. Symmetry. The umbilicus is normal. There's nothing abnormal. I don't see any hernias, abnormalities. I am going to listen to you first before we move into the physical part. I'm going to start. Vowel sounds are active, a normal active. They're not hyperactive or sluggish. I'm going to go ahead and listen to any pulsations, the arteries that run the vascular sounds are also normal. And we listen before we do a palpation so we don't get your bowel sounds hyperactive. So what I'm going to be now is feeling for your liver and, well, we won't be feeling for your spleen. I'm glad we figured that out. And this just kind of helps us know if your liver is within normal limits. So I'm going to percuss. Hear the difference?
Yes.
Kind of awkward not having an exam table, but we'll make do. I'm going to do a light palpation first, just feeling for any abnormalities. Tell me if there's any tenderness or any pain. Okay. Feeling in the mid-clavicular line, I'm just trying to feel your liver span, and it's not swollen or abnormal. Now I'll do a little deep palpation. Okay. All right, that's all good. Next, I'm going to move into your inguinal area. Is this okay? I have to feel for femoral pulse and inguinal nodes on the inside of your thigh right here.
Yes.
Okay. All right. So we're going to checking that femoral pulse, which is normal. It's not bounding. It is a little bit harder to feel through the clothes, but that's all right. And I'm not feeling any nodes, any swollen abnormal nodes, so that's good. All right, we're coming up to the end of our assessment, and I want to make sure we can get your feet in there. All right, I am going to remove your socks. I'm just going to do a visual inspection. While I'm looking at your legs, I want to see from 14 inches. Can you read this top lettering?
The top?
Yes, right here.
Yes.
What does it say?
Western Governors University.
Okay, just kind of checking your visual field. Forgot to do that earlier. All right, so I see your symmetry. Few little scars. You have he's got quite a few scars on his knees. Here's one. Are these scars related to anything on your knees?
Probably martial arts.
Okay, martial arts. Okay. All right. Make sure we don't miss anything. I'm going to feel your popliteal pulses behind the knee. They're symmetrical bilateral, non-bounding, normal rhythm. I'm going to check your posterior tibial right here by your ankle. Also non-bounding. It's a nice, good rhythm. Normal. Your dorsalis pedis. Good as well. Nothing noted. The feet are cool, dry to the touch. They're symmetrical. I'm going to check for edema by pressing. I don't see any edema. Everything looks good. I'm going to check your toes. This is real important for any patients that have a loss of sensation in their feet. And I don't see anything, no cracking. I'm also going to check a capillary refill. And that is normal within 3 seconds. Do you have any tingling or sensations or anything anywhere?
No.
Okay, next we're going to move on to our sensation test. So I'm going to use this sharp edge on this Q-tip and the soft edge, and I need you to tell me if it's soft or hard what I'm touching you with, okay?
Okay.
So we're going to start on your feet. What is that?
Hard.
Okay. And what is this?
Soft.
Soft. Okay, we're going to do your leg again.
Hard.
Okay.
Soft.
All right, we'll do your hands, arms.
Hard.
Can I see the other hand?
Soft.
Okay. What about here?
Hard.
Again?
No, soft.
Okay. Here?
Hard.
All right, we will do a slight test to your face.
Soft.
Okay.
Hard.
All right, thank you. All right. I want to check your position sense. So I want you to close your eyes, and I'm going to move your toes up and down. Tell me which way I'm moving your toes.
Up.
And now?
Down.
Okay. I'm going to place something in your hand to check your stereognosis, and I want you to tell me what you think it is, okay? Eyes closed still. What is this in your hand?
A pin.
A pin, yes. Thank you. Good job. Before getting you up, let me check your Babinski reflex, which is going to be at the bottom of your foot. I'm going to run and make sure the camera can see. Can see. All right, I'm going to run this up your foot. And if you saw that toe curl, and this middle toe right there, thank you. All right, so it looks like we're gonna have you sit back up real quick. Take it easy and slow. All right, good job. We got a few more little tests to run. I am going to check your deep tendon reflexes, and then I'm gonna have you get up and we're gonna do a few range of motion tests. All right, let's do your bicep. And I'm going to do your tricep reflex. Here, just relax your arm. Okay. Your patellar. Good job. Thank you very much. All right, so now this part of our assessment is going to be a little bit more fun. If you could stand up facing me. Okay. All right, so what I'm going to have you do first is I need you to put your finger to your nose, both, back. Okay, good job. And then I would like for you to take your heel and rub it down your shin, each foot. Okay, other one. Okay, good job. All right, now, what I need you to do, and try to, okay, I'm gonna have you back up just 2 steps. Right there is good, and I'm gonna have you walk heel to toe to me. Heel to toe, heel to toe. Good job. And then I want you to turn around and walk on your tiptoes to me. Walk on your tiptoes. Okay, good job. And then I'm going to have you walk on your heels to me. So turn around, walk on your heels. Okay, a little off balance, but try it again. It's kind of awkward. There you go, good job. All right, I'll have you stand right there, thank you. All right, can you do 1 foot and a shallow knee bend with each? Good job, thank you. And can you bend and touch your toes? If not, just let me know, but can you bend over slowly? Okay, good job. All right, the range of motion in your spine looks good. I kind of checked that earlier, no pain or tenderness. I see for the most part you have pretty good balance. You're not wearing your corrective islands as well. Do you think there's anything else? I have a social history that I want to go over.
Okay.
Oh, I know what I need to do. One last thing. The Romberg sign is, I just need you to stand with your eyes closed and just let me see if you sway or not. Just stand. Okay. No swaying. This test is normal. All right. So next I have a few questions about social determinants. These are very, very important.
Okay.
All right, so Mr. Duncan, you can have a seat so you're more comfortable. Let's go over a few things real quick. We're almost wrapping up. I appreciate your time. So tell me about work.
I've been a police officer for 20 years, and because of that, I work a lot of long, stressful hours, rotating days and nights, or being on call and working days in a row, like for a murder or something.
Okay. All right, that does sound stressful. How do you define your socioeconomic class?
My wife and I are upper middle class.
Okay. Do you have adequate housing?
Yes. We live in a brick house. It's in really good shape. There's no damage to it or anything.
Okay. What's your educational background?
I'm working on my second graduate's degree. I graduated with my first one in last year.
Okay, sounds like you have a lot. Do you have future educational plans?
Yes, I want to get my PhD and become a university professor.
Okay, good. That's a good goal. When was your last vacation?
October this year, we went to Disney World.
Okay.
My wife and 4 kids and my in-laws.
Oh, awesome. Who's your primary support person?
My wife, Nichole.
Okay. What does she do?
She's a nurse.
Okay. Do you have access or easy access to pharmacies for your medications or Tikkasen?
Yes, I live about 5 minutes or 5 miles.
Okay. Ever any issues?
Occasionally, there's been some, and it's frustrating, having to, if the pharmacy runs out
Oh, okay.
of medicine, getting it transferred to a different place.
Okay. That can be frustrating. We'll see if we can't maybe find some resources for you, maybe to help you with that. Have you ever used a community resource for your health?
Yes. I was a member of a gym because they gave police officer discounts.
Okay, good. That's an awesome resource. Do you have medical insurance?
Yes, I have good insurance.
Okay. And who's that through?
The state.
Okay. Can you afford your copays for clinic visits and medications?
Yes.
Okay, no issues there.
No.
How far do you live from your primary care provider?
About the same, about 5 miles or 5 minutes.
Okay. And how far do you live from somewhere you can buy healthy food?
Same, 5 miles, 5 minutes.
Okay. And how far do you live from a hospital?
12 minutes.
Okay. And describe your neighborhood for me.
It's a good neighborhood. Everybody is, I would say, upper middle class. It's very safe. A lot of, I believe there's 4 law enforcement officers that live in our neighborhood.
Okay.
So it is a safe environment.
Oh, good. That's very good to hear. Thank you for sharing that with me. Let me just, before I let you leave, let me just make sure we've covered everything. Do you have any questions so far?
No, ma'am.
So, I just to recap, I know that you say you have some chest pain. Your physical exam, I didn't feel any heaves or thrills. I didn't see anything that was irregular from visible or palpation or listening today. So that's good. Your skin looked great. Your head and face. I didn't find any issues with that. Your eyes were good. You were able to do all your cranial nerves were intact. Conjunctiva, your ears, I didn't see any issues there. Your nose looked good. Teeth and gums, you could say ah. Your neck, also no tenderness, nothing found there. Your range of motion in your legs and arms and neck and spine were all good. I didn't find anything in your chest and lungs. Everything was normal, no wheezing. So the shortness of breath, I didn't see any shortness of breath. I know we talked a little bit about that. Let's see. Your abdomen exam was good, except for I did note your splenectomy scar. Your pulses, all your pulses were good in your body, non-bounding. They were symmetrical bilaterally. Your musculoskeletal sensations and everything like that was good. Your reflexes. So what, basically, if you have any issues, I want to encourage you to follow up with your primary care provider. If you have any shortness of breath or the chest pain returns, you can also call the on-call doctor as well. And I really just want to thank you for your time. And I appreciate it. It was good to get to know you. Anything before I go?
No, ma'am.
Okay. Thank you, Mr. Duncan. I appreciate your time. All right.